Welcome to the overview of the nurse practitioner assessment, diagnosis, and management practices to facilitate the clinical management of the patient with Parkinson's disease. My name is Brandon Parkin. I'm a family nurse practitioner, and I currently work in an internal medicine practice seeing patients over the age of 18. The objectives for this short course is to go over the overview of Parkinson's disease, the basic pathophysiology, the basic diagnostic practices, as well as go over some management practices that you may see when caring for patients with Parkinson's disease. The first thing we need to ask is, what is Parkinson's disease? It is a progressive neurodegenerative hypokinetic disease that has resulted from the loss of dopaminergic neurons within the substantia nigra region of the midbrain. Now, the substantia nigra of the midbrain mitigates and controls functions ranging from voluntary muscle movements, cognitive planning, as well as emotions and reward functions. As you will see, more and more of that dopaminergic neurons, as they get destroyed within Parkinson's disease, you will see more and more of these signs and symptoms patients will have as time progresses. So what causes Parkinson's disease? Unfortunately, there is no exact cause known. As more and more research occurs, however, we found that genetics do play a part in the creation of Parkinson's disease. If a family history is evident, then there is an increased chance of developing Parkinson's disease. We have also found connections with some environmental toxins such as organochlorine, pyrethroid, as well as other pesticides that have increased the chances of people developing Parkinson's disease. Now, some of the signs and symptoms that you may be looking for when you see patients start to have Parkinson's disease include those of the premotor phase, which may occur up to 6 years before true motor symptoms actually appear. Now, this list is not comprehensive by any means. However, some of the things you may see include just general dysphagia, bladder dysfunction, generalized pain, inattention, as well as some executive dysfunction issues. Now, as the patient progresses with more and more symptoms of their Parkinson's disease, eventually they'll move into the motor phase, and this is where you actually see some of the true motor symptoms of Parkinson's disease, including the bradykinesia, the rigidity, the tremors, as well as some gait dysfunction. But again, this list is not comprehensive by any means. Now, as we come to the diagnosis portion of Parkinson's disease, oftentimes, unless the practitioner is a specialist in movement disorders, usually a consult to a neuro specialist is warranted. There are no specific markers to best identify Parkinson's disease or progression. It is mainly based on clinical signs and symptoms. Part of the problem is that many other neurodegenerative diseases may act like Parkinson's disease. So one of the primary goals with diagnosis of Parkinson's disease is to rule out other neurodegenerative diseases. This can be helped by MRI scans, CAT scans, as well as labs, in addition to frequent neuro checks. Now, as we come to the diagnosis portion of Parkinson's disease, oftentimes, unless the practitioner is a specialist in movement disorders, usually a consult to a neuro specialist is warranted. There are no specific markers to best identify Parkinson's disease or progression. It is mainly based on clinical signs and symptoms. Part of the problem is that many other neurodegenerative diseases may act like Parkinson's disease. So one of the primary goals with diagnosis of Parkinson's disease is to rule out other neurodegenerative diseases. This can be helped by MRI scans, CAT scans, as well as labs, in addition to frequent neuro checks. Now, to help practitioners steer their diagnoses towards Parkinson's disease, Postuma and colleagues came up with clinical diagnostic criteria for the diagnosis of Parkinson's disease. They came up with 3 cardinal motor manifestations that are related more so to Parkinson's disease. These include bradykinesia, rigidity, as well as resting tremors. Now, they say that you need minimally 2 of the 3 motor manifestations for a more concrete diagnosis of Parkinson's disease. The resting tremor is the one that you may not see in all Parkinson's patients. That may either never manifest or it may manifest later in the disease process. So the question remains, where do nurse practitioners come into the diagnosis and management of Parkinson's disease? Nurse practitioners are in a unique position because, one, oftentimes they're spending the most time with patients, and due to that, they can see the first signs and symptoms quicker. Also, because they are spending the most time with patients, they can catch the progression of Parkinson's disease and be able to tweak medications in hopes to help slow that progression down. So once a diagnosis of Parkinson's disease is determined, the most important thing that you need to realize as a practitioner is that patient treatment is highly specific to that patient. Yes, there are gold standards and treatments to follow. However, not everyone has the same signs or symptoms, and they do not progress in their Parkinson's disease at the same time. Now, 2 common scales are used to help stage Parkinson's disease, as well as help determine how fast or slow the patient is progressing in their disease. The Hahn and Yahr staging system, as well as the Unified Parkinson's Disease Rating Scale. Now we turn towards the treatment and management of Parkinson's disease. The first levodopa preparations medications are the primary way that we can help control the signs and symptoms of Parkinson's disease. With the destruction of the substantia nigra and the dopaminergic neurons, that leaves a lack of dopamine within the substantia nigra to be able to control movements. Levodopa is almost always used with carbidopa because once levodopa enters the system, it is transformed into dopamine. And when used with carbidopa, that delays that change of levodopa into dopamine until it crosses that blood-brain barrier to where it can actually be used to help manage Parkinson's disease symptoms. The next category of medications are the catecholomethyltransferase inhibitors. Now, these are used in conjunction with the carbidopa-levodopa preparations, which then increases the half-life of the levodopa compound so that it is available longer within the brain to be able to be used. The next class of medications includes the ergot and non-ergot dopamine agonists. These medications can be used with levodopa carbidopa, but they can also be used alone. These mimic dopamine at the receptor sites, which then hopefully in the meantime will decrease the levodopa dose requirements. The next medication class includes the monoamine oxidase type B inhibitors. These get into the blood-brain barrier and actually prevent the breakdown of dopamine so that more is available for use. Now, to help provide all-encompassing care, there are alternative treatments that have been found to show a decrease in Parkinson's disease symptoms. These include acupuncture, guided imagery, chiropractic intervention, yoga, biofeedback, massage, tai chi, as well as boxing. Now this list is not all inclusive, however these are the most common that you will find when you are managing a Parkinson's disease patient. Now, one of the most important things we need to do as practitioners is to educate both the patient and the family. They need to know that Parkinson's disease is a progressive disease. We do not have a cure for it. However, with the current treatments and research, we have found to be able to slow the progression of the disease down significantly enough that we can have a meaningful quality of life increase when someone's diagnosed with Parkinson's disease. As nurse practitioners, again, we may be the ones seeing these patients the most, so therefore we're the ones that are going to gain the trust of the patient and family. We're going to be the primary educators, and again, we're going to be the ones that are monitoring the progress of this disease. So one of our key jobs is to support that family and patient, as well as provide that education they need. Thank you for listening to my presentation on the diagnosis and management of Parkinson's disease. Here are the references that I utilized during this research. Thank you.